Hi everyone, welcome back to my YouTube channel, and today we are going to talk about injectable or implantable contraceptives. So let's start our topic with introduction. Injectable and implantable contraceptives are long-acting reversible methods of birth control. They provide effective, convenient and reliable protection against pregnancy without requiring daily attention. These methods are particularly useful for women who prefer not to take oral contraceptive pills or who want long-term contraception. Injectable contraceptives. Injectable contraceptives are hormonal injection given at regular intervals to prevent pregnancy. They usually contain progesterone alone or in combination of estrogen and progesterone. Common types of injectable contraceptive include depo provera, that is progestin only injection and it is given every 3 months. And then we have is combined injectables that contain both estrogen and progestin and it is administered monthly. Now we will talk about mechanism of action of injectable contraceptives. They work by preventing ovulation by suppressing hormone release. They thicken cervical mucosa, making it difficult for sperm to enter the uterus, and they also alter the uterine lining to reduce the chances of implantation. Now let's talk about advantages of injectable contraceptives. They are highly effective, over 94% with typical use. They are convenient as they require only periodic injections. They are suitable for women who cannot use estrogen or progestin only options. They reduce menstrual cramps and risk of endometrial cancers. Disadvantages of injectable contraceptives. The irregular bleeding or spotting may happen especially in the first months. Possible weight gain, mood changes or decreased bone mineral density with long-term use may happen. Delay in return of fertility after discontinuation and it may take several months. No protection against sexually transmitted infection is present in the case of injectable contraceptives. Now let's talk about implantable contraceptives. Implantable contraceptives are small flexible rods that are inserted under the skin of upper arm. They release progesterone continuously over several years, and common types include implanon or nexplanon that are single rod effective for up to 3 years. Then we have is norplant that are multiple rods and they are effective for up to 5 years, but they are less commonly used now. Mechanism of action of implantable contraceptive. They prevent ovulation by suppressing hormone release. They thicken cervical mucosa to block sperm entry. They thin the uterine lining, thus reducing the chances of implantation. Advantages of implantable contraceptives. They are extremely effective over 99% of the cases. They provide long-term protection like 3 to 5 years. They have rapid return of fertility after removal. Low maintenance is required as no daily or monthly action is required in the case of implantable contraceptives. Disadvantages of implantable contraceptives. Irregular menstrual bleeding is common. Second disadvantage is possible side effects may happen that include headache, weight gain, acne, and mood changes. Third, they may require minor surgical procedure for insertion and removal. And no protection against sexually transmitted infection is there in the case of implantable contraceptive. Comparison of injectable versus implantable contraceptives. Duration. Injectable contraceptive lasts 1 to 3 months while implantable contraceptive lasts 3 to 5 years. Effectiveness. Both types are highly effective but implants are slightly more reliable than injectables. Third is fertility return. Fertility return is faster after implant removal and it's slower after stopping injectables. So it is more beneficial in case of implantables than the injectables. Convenience. Implants require one-time insertion while injectables require regular clinic visits, mostly monthly or 3 monthly visit. Conclusion of this lecture video. Injectable and implantable contraceptives are safe, effective and convenient options for women that are seeking long-term birth control. While both methods have side effects, they offer significant benefits in terms of reliability and reduced need for daily compliance. Choosing between them depends on individual health, lifestyle, and reproductive goals, with medical guidance ensuring the best options. And this was all about implantable and injectable contraceptives. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.